And to now introduce our moderator, but also tell you about some great upcoming Friday programs, please welcome your Vice President and Program Chair, soon to be your President-elect, the Chief Marketing Officer and Vice President for Public Affairs at Pepperdine University, Rick Gibson.
Well, thank you very much. We're so delighted to have you here today. I'm confident this is going to be an interesting panel and a great discussion, thought-provoking to say the least. And I want to thank John Lockhart for putting this together and working so hard. And for next week, I want to make sure that you know about what's coming up May 18th right here at the California Club. Another situation very similar to this, where we're going to continue as we make our way to the home stretch of our program this year, issues and answers, as we deal with some vexing and pressing issues that are part of our community. And so next week, we are looking forward to a conversation around fire preparedness and prevention. There are those who will say that fire, as we have noted it in the region recently, is becoming more of the new normal as our environment changes. So how do we prepare for that? How do we prevent that? How do we, as a community, get behind the resources that we need for that? So next week, that will be May 18th, California Club. It should be a full house. We're looking forward to that conversation. Also, I want to let you know, as we continue to round out the year with upcoming issues and answers, we've invited the next two guests, and I have to tell you, I don't know what keeps you up at night, but I'm about to tell you what keeps me up at night just a little bit. We have two fascinating guests that are coming, but they have a sort of a caveat to their appearance. They need flexibility, they say, because of the nature of their work, and so they've just given me a heads up that several things could call them away. But right now, we're very excited that Dave Jones, who is the Insurance Commissioner for the state of California, will be joining us on June 1st, right here at the California Club. And then David Wright will be, who is the General Manager of the Los Angeles Department of Water and Power. You probably know that Mr. Wright is the General Manager of the largest public utility. So it should be a fascinating conversation with both of those as we begin to wind down our year. So more about that as the day approaches, but I wanted to give you a heads up about what was coming to LA5. Today, I am delighted to welcome our panel, and they'll be making their way to the front here in just a quick moment. This is probably a topic. We already had a little bit of a conversation earlier in the year with Tom Prisilak from Cedars-Sinai. But this is an important and challenging topic for us, and I know we're going to dive deeper into it. We've allowed some time for Q&A, so I'll move very quickly and introduce our moderator, who has asked me, please, Rick, please give me a very short introduction. I'll just simply say that not only is he a legal expert and a lawyer, he is the co-author From Obamacare to Trumpcare and Why You Should Care. And he is part of, as Cherie said, Nelson Hardiman, a law firm focused on healthcare. He's going to guide the conversation today, and he's going to introduce our panelists. So would you please give a warm LA5 welcome to our moderator today, Harry Nelson.
Thanks, Rick. It's great to be with you. While I'm just going to make a very brief introductory remark, if I can ask our four panelists to come up, Andy, Joe, Shah, and Scott, that would be great if you guys can. I don't want to rush your lunch, but since we only have a little bit of time, that would be wonderful. So it's great to be with you. I have to be honest, this is not only my introduction to LA5 for me, but also to Rotary, and it's really a thrill to be with you. I want to thank all of you for having us, and I want to thank John Lockhart for having the vision to put this event together. John has been tirelessly working to bring the business leaders together and to bring new ideas together. And I'm excited to be moderating today because we have a fantastic panel. In just a minute, I'm going to ask them to introduce themselves, but just to sort of talk about how we're going to use the time together, what I'd like to do is have a conversation not only about where we are in healthcare, what's up with healthcare, but also where we are in Los Angeles. We're lucky to have with us the CEO of Good Samaritan Hospital, Andy Leeka, and as well as the Chief Medical Officer of California Hospital Medical Center, two of the key institutions that are really on the front line of taking care of the community, not just in Los Angeles, but really as you walk out of this building. We also have people who are really visionaries, and I'm not trying to be exclusive in saying this, but both Shah, Ghodsian, and Scott Kaiser working on the front lines of both behavioral health and a next generation healthcare and what that looks like. So without further ado, we're going to dive in. I'm going to ask each of the panelists just to give us a brief introduction about their job, their organization, and sort of their perspective to frame our conversation today. Andy, if I can put you on the spot.
Good. Thanks, Harry, and thank you for this nice invitation from LA5. My name is Andy Leeka. I've been at Good Samaritan. We were founded in 1885, so we're in one of the oldest hospitals here in Los Angeles. I've been here for about half those years. And it's, I think what differentiates Good Samaritan Hospital maybe from other hospitals, there are about 14 hospitals in downtown Los Angeles, so it is a well-bedded community. Most of these hospitals operate at about half capacity. I think our real niche for this downtown community is we really specialize in what are termed the more acute services, tertiary care. We have large heart services, large orthopedic, one of the largest retinal repair centers west of the Mississippi. And just to kind of end on a note, I think for me, the challenge is putting together a team that can deliver the type of care that you would want your mother or father to receive at a hospital. So it can't just be that technical, and believe me, we have the best of the best technical equipment in there from cath labs to EP labs, but it has to be delivered with a lot of dignity, with a lot of access, and it's got to be affordable as well.
Thanks. Joe, can I ask you to do the same?
No, sure. All right. Hi, I'm Joe. Thanks again for all having me here. I'm the Chief Medical Officer at California Hospital Medical Center, and like Andy mentioned, we are one of the other hospitals. We're actually down in South Park, right about 2 blocks from the Staples Center and LA Live. Similarly, we are part of the Dignity Health System. We're about a 40 hospital system in California, Nevada, and Arizona. We have been here quietly for over 130 years, serving the community. So as the Chief Medical Officer, I interact with the executive leadership team and I have oversight and responsibility for delivering, ensuring the quality and safety of the care that we deliver to our patients every day. And more so, I think, as we get into it today, it's not just the responsibility as when the patients are in our doors, but actually before they come in to our hospital and after they leave, making sure that they have a safe place to land and they're plugged back into the system. Because I think as we'll talk about a little more, we have a very, very challenging population. Even though we see all of this growth, we still have a very, very challenged community to the south in our primary service area.
Yeah, please, Scott.
Well, thank you all. It's a pleasure to be here. So I'm Scott Kaiser. I'm a geriatrician and the Chief Innovation Officer at MPTF. So as you can imagine, I spend a lot of time answering the what, the where, the what the heck is that, right? So a geriatrician obviously is a physician that specializes in the care of older people. MPTF, the Motion Picture and Television Fund, we've been around about 100 years. Started by Mary Pickford, Charlie Chaplin, Douglas Fairbanks as a relief fund, a safety net for people, the men and women working in the film industry, and that's what we do today. For people working in the industry, we're there as a charitable organization. We act as a safety net through a variety of health services, social services, and financial support. And my role as the Chief Innovation Officer is really to think about a population health strategy for that community, the men and women working in television and film.
Shah.
Thank you, everyone, for your invitation. My name is Dr. Shah Ghodsian. I'm the founder and CEO of Clinics on Demand. Clinics on Demand was started as a response to the national and local opioid and overall substance abuse epidemic that we are in the middle of now. It was started actually right when we were in the cusp of it, and right now we're at the what we hope is the peak. So the program is based on delivering substance abuse disorder treatment to people anywhere in the country at any location, at any demographic population, delivering it directly to them at their house rather than having to travel anywhere to receive treatment. So this is particularly important for people in rural areas, for example, who don't have access to treatment, or people in even urban areas who wish a more convenient type of treatment for substance use disorder.
Terrific. Thanks. So, all right. So I want to jump in. We had a conversation last week with the panel, and three themes came out that I hope we're going to cover in our time together. First, one is about this concept of social determinants of health, which I'm going to ask. We're going to have a conversation about, and how the nature of how we treat people has changed over the last decade, and examples of that. Another topic that you can't talk about healthcare without talking about the problem of unaffordability for all of us, and particularly the growing disparities. And the third theme that came across that I hope we'll really dive into is the need for more access to behavioral health and how we deal with the opioid crisis. And so these are kind of the big three topics. Certainly you could have this conversation and spend time on, and maybe we'll have time if people have questions about the changing nature of healthcare consumers, patient expectations changing, cost pressure as we sit 6 months before the midterms, a political uncertainty and how you deal with that, technology. There's no shortage of, we could be here for 6 lunches. But so before we get into the specific topics, I just wanted to take another minute. Dr. Kim made a reference specifically to some of the challenges of the local population, and I think each of you, particularly Andy, Joe, and Scott, you have sort of unique perspectives on what the unique challenges of the LA, Los Angeles, the downtown market, and the Los Angeles healthcare landscape looks like from that differentiated. And I'd love some thoughts if you can share on that question. Yeah, please.
I'll jump in. So it's a huge challenge. What a mixed population. Here we have the regentrification of downtown Los Angeles taking place with 60,000 residents now living down here. 500,000 residents drive into downtown Los Angeles every day. And if you look over by South Park and other areas, you'll see cranes in the air. So there's another 40,000 online. If you look at that demographic, these are the wealthiest of the wealthy. There's a higher per capita income downtown Los Angeles than there is in Beverly Hills. 43% own dogs. I mean, it just goes on and on. And so this is these are all of you that raise those millennials out there that are really difficult to please without gourmet dinners and everything. Those are the folks coming through our emergency department with a homeless population here in LA County that is now 57,848 homeless, and you've seen the escalation in this. So if you just head east to us and go over on 5th Street, 6th Street, Gladys Street, Wall Street and so forth, from Midnight Mission to Fred Jordan Mission and so forth, those are also the patient population that we have to care for, and they usually converge if it's emergent in our emergency department. So, you know, we won't go into too many things clinically, but they're different needs. They're just different needs with this population, socially, physically. You know, just healthcare has been neglected with certain numbers of these individuals versus some of them can walk in with their PPO insurance anytime they want and forget the $4,000 coinsurance or deductible with that. It's affordable to them. Of course, the free care through an emergency department, we are required to take. Anybody can come into our emergency department, seek services, and we do deliver them and do a great job. But, you know, different expectations with that. The only thing I'd end on is, I would say something. Our homeless are, I think, some of the most sophisticated homeless in the country. They've been to medical school because, you know, when they come in, the first thing, you know, usually they'll do is say, I'm having a stroke, I need opioids, and they'll go down the list with the printout of all their medications and everything else in order to stay out of the misty rain this morning. We'll see a surge. In the very hot weather, we'll see a surge. So we not only just take care of them medically, we clothe them, we feed them, we try to get them back into the right setting.